The reliability of users is crucial for best practice decisions in care of these babies. Following the definitions for each item enables the scorer to accurately assign a number to each sign or symptom of withdrawal. These definitions ensure an objective approach to scoring infants experiencing withdrawal symptoms. Definitions for each follow. The first definition is crying. There are two choices to consider: excessive high-pitched, which would indicate a score of 2; continuous high-pitch, which would indicate a score of 3. This item can be very subjective, since an infant's cry may vary in pitch. Therefore, it is important to use timing for a more accurate score. Allow the infant the opportunity to self-console for 15 seconds. Intervene after 15 seconds and score 2 if the infant settles within 5 minutes with interventions. An infant scores 3 if unable to self-console and can't settle for greater than 5 minutes despite caregiver interventions. Interventions may include swaddling, standing, and rocking, skin to skin, or a pacifier. The next definition is sleep. Score the infant based on the longest period of sleep during the interval between feeds. The interval only receives one score from the 3 levels. Sleep less than 1 hour after feeding, the score is 3. Sleeps less than 2 hours after feeding, the score is 2. Sleeps less than 3 hours after feeding, the score is 1. Take note that if the baby is on a 3-hour feeding schedule, the item sleeps less than 3 hours should not be scored unless the infant wakes up on his or her own or after being asleep for at least 2 hours before the next scoring interval begins. Do not score a sleep interval if the baby does not wake up spontaneously. Example: an infant falls asleep at 9:25 following a feeding. Infant awakes at 10 o'clock, falls back to sleep at 10:10. Infant wakes again at 11:45. Since the longest sleep cycle was 95 minutes, the infant would receive a score of 2 for sleeping less than 2 hours at a time.
Our next definition is moral reflex. The moral reflex is a normal newborn reflex, and there are several ways to elicit it. The infant should be consoled, quieted prior to scoring, but remain awake. One way is to lift the infant by the wrists or arms slightly off the crib, about an inch. Allow the infant to gently fall back onto bed. The reflex normally occurs in 3 segments. The infant's arms will straighten, elbows will move away from the body, and extension of the wrists and opening of the fingers will occur. This is followed by the thumb and first finger forming a C, and the arms return to midline. Normal infants will have slight jitteriness of the hands when they elicit this reflex. Hyperactive moral reflex should be scored in the following manner. A score of 2 is given if there is jitteriness that is rhythmic, symmetrical, and involuntary during or at the end of the moral reflex. A score of 3 is given if there is pronounced jitteriness that is rhythmic, symmetrical, and involuntary, and clonus of hands and or arms present during and following initiation of moral reflex. Clonus is repetitive involuntary jerks of the wrist or ankle. This may occur during and following initiation of the moral. Our next symptom definition is disturbed tremors, which can be mild or moderate to severe. For disturbed tremors, the assessment is done while the infant is being handled. Mild tremors are jittery movements of the hands or feet and are given a score of 1. Score both boxes, disturbed and undisturbed, independently. If both disturbed and undisturbed tremors are observed, score for each. Once again, for disturbed tremors, the assessment is done while the infant is being handled. Moderate or severe tremors are jittery movements of the arms or legs and are given a score of 2. Score both boxes, disturbed and undisturbed, independently. If both disturbed and undisturbed are observed, score for each.
For undisturbed, baby is awake. The assessment should be done while unwrapped and observing for 30 to 60 seconds while not touching the infant. Mild tremors are jittery motions of the hands and feet. Score is 3. Score both boxes, disturbed and undisturbed, independently. If both disturbed and undisturbed are observed, score for each. For undisturbed tremors, the baby is awake. The assessment should be done while unwrapped and observing for 30 to 60 seconds while not touching the infant. Moderate to severe tremors are jittery motions of the arm or leg, and the score is 4. The following video shows a baby that's experiencing moderate to severe tremors since his arms or legs are tremoring. The baby has been undisturbed prior to these movements. This baby would get a score of 4.
Babies. They stay an average of 24 days. So what is she going through right now?
Right now with this baby, what you're seeing is she's having tremors. Her muscles are pretty tight right now. You can see how her arms are really just locked tight.
What's that called, hypertonic?
Hypertonic is what that's called.
Andrew Presnell works solely with NAS babies.
This increased muscle tone, you get 2 points.
The severity of their withdrawal is scored on a point system.
She's going to get more points if she is just laying there not being touched at all and she is shaking like she is now. She could get 3 to 4 points just from that.
Babies. They stay an average of 24 days. So what is she going through right now?
Right now with this baby, what you're seeing is she's having tremors. Her muscles are pretty tight right now. You can see how her arms are really just locked tight.
What's that called, hypertonic?
Hypertonic is what that's called.
Andrew Presnell